Hi everyone, so it's Monday, October 4th, and we had planned to go live today at noon. Unfortunately, Facebook and Instagram are both down, so we're just gonna shoot a quick little video answering some of the questions that you guys had submitted beforehand. We wanted to make sure that we address those as soon as possible. So the first question I have here, what injectable products do you offer and can you explain the difference between them? So at Exert Clinic, we have all the major types of Botox, botulinum toxin, so that's what you use for your anti-wrinkle injections. Any wrinkles that come up when you move your face, those are called dynamic wrinkles, can be treated with Botox, Dysport, Xeomin, or Juvo. Those are the main 4 brands of botulinum toxin. And then the other side of the injectables is the fillers. So fillers are actually a gel that can help replace lost volume. So when you inject the filler into an area like a wrinkle that's always present, not just when you're moving your face, the filler can fill in that lost volume, any bone loss, and kind of pull everything back so that there aren't as many wrinkles. At Exert Clinic, we use Restylane products for our fillers. I think that they're a great brand. They have a whole portfolio with a lot of different types in it. So you can't use the same filler in your lips that you use in your cheeks. So I build a customized treatment plan for each patient based on what bothers them the most. All right, so next question. This one's really common. I get it all the time. It's how long does Botox typically last? So a person that gets Botox done for the first time, I usually tell them anywhere between 3 to 5 months. I've actually found that Dysport lasts the longest. It's also very strong, so I tend to recommend that for my patients that don't want to come in as often. It's very dependent on how many units you do, so if you only get a small number of units, you don't follow my recommendation, then you're not going to get as long lasting of a result. Next question is, what is a liquid facelift? So a liquid facelift is one of my favorite procedures to perform here at Exert Clinic. It's when you get the result from a facelift, but you don't do any surgery. You use different types of fillers and you treat different areas with filler to help pull all that skin back. For example, I have a lot of patients that come here and they're bothered by, looking tired, feeling like, their tear troughs are puffy. They didn't look like this when they were younger. So when you do a liquid facelift, you add filler in all along the cheekbone. You could do a little bit of tear trough, some nasolabial folds. And when you add that in all together, in with like the chin, the jawline, then you can have a facelift look without having to undergo surgery. Next question is, I've never had filler before, what can I expect? Well, a filler appointment, it kind of varies based on what area you're being treated in. I always tell my patients there's a possibility that you're going to have bruising afterwards, so make sure you do it, a couple of weeks before a big event because you want to make sure that swelling and possible bruising is completely resolved by then. At your appointment, I'll talk to you, give a full consultation, and we'll get a complete treatment plan together. That might take multiple visits in order to get the aesthetic look that you want to achieve. The actual filler process, I pretty much numb up the skin, depends on how many syringes we're doing. We might do a little bit of laughing gas just for patient comfort, but the entire appointment shouldn't take more than an hour and you're gonna leave just looking really happy about yourself. And the next question is, I'm looking for a weight loss program. Can you tell me what your program offers? So my weight loss program, it's all inclusive. I include the visit with me, the physician. There's a full medical history, a physical exam. I give you the prescriptions that you can get at any local pharmacy. They're very cost effective. And I also include the weekly lipotropic B12 injections. That's something that kind of sets us apart in our low monthly price. It's just $150. And you only have to come in every 4 weeks, not on a weekly basis. Okay, now I have a couple of questions about the Xpress lipo procedures. So how long does the Xpress lipo procedure take? That depends on the area that's being treated. It comes down really to how much fat there is there to suck out. So in a larger area, so if you have an abdomen, you're doing the upper and lower abdomen, that can take, you know, anywhere between 2 and 3 hours. That includes some time where we're just waiting for that numbing anesthetic to take effect. The great thing is you get to choose your music, you're awake the whole time, and you're breathing in that laughing gas to keep you completely comfortable, so there really shouldn't be any pain. Okay, I'm interested in lipo. Am I a good candidate for liposuction? So this is where I tell everyone you have to come in for a consultation. I can't just give you know, everyone the same answer. So if you're generally healthy and you have a defined pocket of fat that's really bothering you, or you know, multiple areas that we can talk about, you can come in for a consultation. The great thing about Exert, I've got a really advanced imaging software where I take pictures from different angles and we can generate a 3D image, and then I can simulate what your result could look like afterwards. So that just really helps patients visualize the procedure that they're going to have. All right, last question here. Are you hiring? We get this question a lot. We are hiring at Exert. Specifically, we're looking for medical assistants and scrub techs. So if you think that you have this kind of experience, we would love to hear from you. You can send us your resume to frontdesk@exertclinic.com, and we really look forward to hearing from you soon. So that's all the questions that I have today. Really sorry that we couldn't go live during, you know, this worldwide outage, but we'll be here again next week. That's going to be next Monday, and we're going to be live again 12 o'clock Eastern time, and I hope to see you soon, and we'll have some more questions to share.